Well, thank you all for joining us today for ACMHAI's webinar. We're pleased to hear from our speaker about her organization, Easterseals Dupage and Fox Valley Mental Health and Family Support. Our speaker today is Brittany Wilkie, and I'm going to give a little background about Brittany before she begins her presentation. And this, just as an FYI, this came up through this topic actually came up through one of our committee meetings talking about the intersection of IDD and behavioral health. And so the work that Brittany's organization is doing, her name came up. So we're so thrilled to have her today speak to you all. And this is recorded for future viewing. So Brittany is a clinical social worker and serves as the Director of Mental Health and Family Support, specializing in supporting children and families. Practicing through a developmentally based and trauma-informed lens, Brittany utilizes play therapy, relationships, and movement to help children and their caregivers connect and learn about their bodies and emotions. Brittany believes that every child is managing their feelings in the very best way they know how and strives to help understand the why beyond their behavior. She is certified through the Trauma Research Foundation's certification program in traumatic stress studies, led by Dr. Bessel van der Kolk, and through Erickson's Institute Facilitating Attuned Interactions, or FAN, training program. Brittany's work is also informed by her years of experience working at DIR Therapeutic Day School, serving children with autism, in addition to working privately with children and their families who are experiencing concerns related to developmental trauma, attachment, emotional regulation, adjustment, autism, sensory processing disorder, anxiety, and related diagnosis. So thank you, Brittany, for joining us today.
Yes, of course. Thank you so much for having me. It's really nice to meet everybody. I'm going to go ahead and, Jody, am I able to share my screen? Is that, yep, okay, perfect. Okay, let me put this in. You can see, okay? Okay, there we go, perfect, okay. So as Jody mentioned, my name is Brittany Wilkie. I'm a licensed clinical social worker and also the director of our mental health program at Easterseals. I'm going to kind of go through just a little bit about our program, just so you have some background information about the work that we do. And then I'll dive into more information around how the kids that we work with, the population that we work with, and how we see that intersection between the mental health challenges and IDD. And then, of course, please, let me know if there's any questions that anybody has. I will kind of go through and then happy to answer anything at the end. So at Easterseals, our vision is that we believe that every child deserves to thrive in an inclusive community. And our mission is to ensure that children with disabilities and their families are empowered. That is one of our biggest pieces, is we want to make sure that families that are coming to us and children that are coming to us, they feel empowered of their own journey, within their own journey. We identify a child's developmental delay or disability, and we help the children reach their developmental milestones and strengthen his or her abilities through very individualized rehabilitation. And it's very comprehensive too and interdisciplinary, which we'll talk a little bit more about. Today, we each week, it's a crazy number to me when I see this every time, but we see 1,000 infants, toddlers, and children with developmental disabilities, medical complexities, kids that are undiagnosed, kids that we haven't quite figured out what is exactly going on, and to provide, again, the personalized therapeutic services that they need. Services. So as I was telling Jody a little bit earlier, Easterseals is national. Our national hub is located in Chicago, but each Easterseals is its own entity. It's individualized. And so our DuPage and Fox Valley, which is our region, we have our centers in Elgin, Naperville, and Villa Park. And then through our early intervention program, we also go into clients' homes in the community and then offer teletherapy as well. are multidisciplinary services. We have physical therapy, we have occupational therapy, we have nutrition, we have speech and language pathology, we have assistive technology, audiology, mental health and family support, specialized clinics that include autism services. And then we have therapists that are bilingual in a range of different languages as well across our sites. Important to note is our growth that we have had with Hanover Township. We've had an 18-year collaboration, which has made tremendous differences in all of our clients. And just, again, specifically those with intellectual and developmental disabilities and their families. Especially during COVID, financial support from Hanover Township allowed us to keep our doors open, to provide services that families needed and those families who really needed us most during that time. Hanover's generosity has allowed us to purchase important tools and technology that we need to follow the enhancement of equipment and services that are needed so we can continue to provide quality services. And then also their investment in the workforce, in our workforce, has been instrumental into supporting our team and providing the care with children who have complex conditions and who are also in underserved communities. Okay, a little bit about our mental health program. So we've part of our program has been since 1980, but really our particular program has grown tremendously since about 2021. And so right now, we went from a team of 1 social worker and 2 parent liaisons to now we have 7 social workers that have specialties in a range of different areas: trauma-informed care, DIR, infant mental health, FAN training, medical interpretation services. So we have lots of different areas that our social workers are gifted in. We also have a care coordinator that has a mental health background and a clinical psychologist that is bilingual. So that's just a little bit about our team here. I'm going to move this far out of my way. Okay. A range of support include, so we do on our website, we do offer free social emotional screenings that are available in English and Spanish. We provide mental health evaluations, care coordination services, which our care coordination services are for any family that is receiving services here. And our care coordinator very much focuses on helping connect families with resources while also really highlighting those really important transition periods of a child's life. So aging out of early intervention, going from middle school to high school, reaching adulthood. She provides lots of different resources and guidance during those times, help parents to feel prepared of what's next. How do I help prepare them for what's next and what can they expect? We provide individual social work counseling, parent support groups, children community groups, education programs, lots of resource information. And then we have a variety of clinics. We have a feeding clinic, a bowel and bladder clinic, an autism diagnostic clinic, and a medical diagnostic clinic. Our medical diagnostic clinic is for early intervention, so birth to 3. And these are interdisciplinary clinics. So we have social work is involved in every single one of them alongside OT, PT, speech, etc. So we're looking at the child as a whole and really evaluating them comprehensively. Okay. As you all are aware, individuals with intellectual and developmental disabilities, they experience a range of challenges in very key developmental areas. And they begin in childhood, impacting physical abilities, impacting communication, social, emotional, behavior development, and learning. Again, as you all are familiar with that. So what we see, intellectual developmental disabilities and the intersection with mental health. And so for us, we know youth with IDD are at an increased rate for various types of high stress experiences and trauma. We have a lot of medical trauma. That's where we particularly see a lot of medical trauma. So traumatic pregnancies, traumatic deliveries, significant NICU or PICU hospitalizations, ongoing surgeries, frequent healthcare appointments that may be with physicians and or therapists. And then just in general, right, we know that youth and IDD are at increased risk for physical, emotional abuse and neglect, sexual abuse, educational needs, outplacement of schools, experiencing schools that can't meet their needs and having to shift back and forth. Bullying and teasing, exploitation. This has been a big one in the last couple of years of just exploitation through social media from peers. And of course, discrimination and related to their abilities, race, ethnicity, socioeconomic status. So for us here at Easterseals, we support the educational needs. We support the bullying and teasing, exploitation, discrimination, medical trauma, the pieces where we very much refer out to more specialized, a different specialized area is when it is leading to the physical and sexual abuse. That is when we are supporting families on finding the right specialized care for that. So when we look at trauma and high stress exposure, that is putting our children that we see at risk for mental health concerns that are really related. We're seeing a lot of anxiety and depression. Another huge one has been just decreased sense of self and decreased self-esteem. Emotional and physical regulation, challenges with attention, difficulty with adjustment, and attachment related struggles and PTSD. Okay, so let's dive into some of like the nitty gritty. So when we think about trauma and the children that we are seeing, so when a trauma happens, right, it bombards our nervous system, and our nervous system becomes wired to respond to stress. And so a lot of our children, right, they have had these shifts in their nervous system from very, very early on. And their body holds on to that. Their body codes these experiences that send their bodies into these high states of arousal or shutdown. And their bodies hold on to this. And so we see these kiddos come to us severely dysregulated because of the way that their nervous system is responding to different stimuli and different experiences. Some of these experiences, some of these memories are implicit, right, which is the unconscious. So we have, when we think back to pre-verbal, which we call pre-verbal developmental trauma, is in utero, in the NICU, before our babies really have a conscious of what's happening. In the NICU, we have, right, it's very overstimulating. There's noise. Their babies are being kind of pricked and prodded, right? There's surgeries that are happening. And so we see later on in life that sensory processing disorder develops. Kiddos are very overwhelmed by certain sensory stimulation. And I'll talk more into how that leads into dysregulation and what we do. And when we think about that, this visual here of the front brain and our back brain, this is something that we're always thinking about. So the front part of our brain, our prefrontal cortex, right, is our reasoning. It's where we can think. It's where we can make logical decisions. It's where we can be available. We're available for learning. We're able to be responsive. We're able to think. We're able to stop and respond. In the back part of our brain, right where it's like our alarm system, okay? And it's where our survival goes into play. And that's where all of our big feelings and our natural physiological body responses are coming into play. And we all respond differently in this. We fight, we flee, sometimes we freeze. And so this is where a lot of our kids are spending their time, is in this back part that is in this stress response. So one thing that I think about when I think about back brain, so here's like a story. I always like to just kind of bring in stories. So this was back many years ago. I went to college in Iowa, and it was winter, and I was with two friends, and we were driving back to Illinois. And I was the driver, and then I had someone in my passenger seat who was awake and with me, and then we had a sleeping passenger in the back seat. And we're driving on 80, and we are approaching an overpass, and the snow is coming down pretty hard. And on the overpass, there is a truck, a plow truck that is plowing the road on the overpass. And all of a sudden, the snow, I mean, heavy piles of snow is coming over the overpass onto 80, onto the highway. And again, it's slippery and everything like that. And I'm driving, and I am anticipating this snow is coming straight on my car. There's like nowhere to go. There's really nothing that in that moment that I was like, what can I do? What can I do? And so I am just driving, going, okay, this snow is coming onto my windshield, onto my car, and we're gonna have to somehow cope with this. And so sure enough, the snow comes over and boom, right onto my windshield. It was a very, very loud noise. I kind of went into almost kind of like a shock freeze. My windshield wipers both flew off my car. And so I'm kind of in this, like, I just have to keep driving. I have to kind of get through this. The snow is coming down. I have no windshield wipers. So my passenger rolls down his window, and I don't even remember what he used or how he did it, but he is continuing to try to clean my windshield of the snow, because we could pull, this is like, right? This is our like 18, 19-year-old brains that are not fully developed. Like, what do we do? And so, but we were trying to find an exit is also what we were trying to do, so we could get to a car place. And so he's trying to clear my windshield. The person in the back, as soon as that snow hit, he popped up and was in complete fight, right? Because he was like, what just happened? Because he just hears this loud kaboom. And so he kind of stays in this state of like panic and fight, because me and my passenger saw this coming while we were still in this moment of shock. We had a sense of like, okay, this is happening. He woke up with absolutely no idea. And so we get off the road, we get to some kind of auto place, we get new windshield wipers, we're good to go. But kind of thinking about this story is, of course, it's not like the most traumatic story, but it was in that moment a traumatic experience. And we all had our very own kind of response to that. And so I think what's also important so much in thinking about this is the kiddos that we see. Each child experiences trauma in a different way, and they have a different experience around it. Again, me and my passenger, we saw what was happening. We knew what happened. The passenger in the back seat was unconscious, right? At that moment, he was sleeping, and all of a sudden he got brought into this response without awareness. And so we processed this afterward of like, gosh, what was your experience? What was mine? Realizing we all had a different response and a different experience in that moment. And so when we think about that, we always want to be thinking about what is happening for our kiddos. What have they experienced, and what does that look like, and how are they portraying that? So when we're having these responses, what are we seeing? Do we actually see? We see the behavior. So we're seeing the emotional outbursts, we're seeing aggression, self-injury, avoidance, verbal outbursts, withdraw, meltdowns, fear, right? These are the things that we see. But what does that mean? And how we view behavior is a type of communication. It's all a form of communication. I'm scared. I don't understand. I'm nervous. I don't feel safe. I'm frustrated. I'm overstimulated. I'm struggling. I don't have the words right now. I don't know what to do. I don't feel good. I feel shame. Maybe I feel guilty. So when we look at, everyone may have heard of this analogy of the iceberg, but this is something that we think about and talk with parents all the time, is the iceberg. The tip of the iceberg is what we see, and that is the behaviors. That is what is explicit, right? But that's just a tip. The bigger part of the iceberg is always underneath. And those are the things that we don't, quote unquote, see, that we really have to be mindful of and that we always need to be thinking about. Again, I like to tell stories. And so a story that I often think about in this is that I was working with a little guy, and another time in winter, and he comes in and he gets into a swing and he looks at me and he goes, "Miss Brittany, my hands are stupid." And Dad was, "Oh, buddy, we don't say that. We don't use that word." And I was like, "Okay, this doesn't feel like an uncomfortable word, but hold on, buddy. Your hands are stupid. Tell me more about that. What do you mean? I'm looking at your hands. Tell me why you think they're stupid." He goes, "I can't get my gloves on." And I was like, "You can't get your gloves on?" He's like, "No." He had gloves, right? With not the mittens, but the gloves that you have to put all of your fingers in. And he couldn't get his hands in his gloves. And it sent him into a state of distress. And so I think before that, before he had came, he was dysregulated. He threw the gloves, right? There were some other behaviors before he came that I didn't see. And so I said, "Oh, buddy, like that is so hard. And that has happened to me before. It is tricky to get each of your fingers into a glove." And he goes, "It's happened to you?" And I said, "It has happened to me." He's like, "Do you have gloves?" I said, "I do have gloves." He's like, "Can you go get them?" And I said, "Yeah, buddy, I can go get them. I'll go get my gloves." So I go and I get my gloves and I bring them back. And together we practice putting them on. And we worked through. There were moments that he got frustrated because 2 fingers went into one hole. And he's like, "See, I can't do it. My fingers are stupid. My hands are stupid." It's like, "Oh, these tricky gloves. How are we going to get your fingers in these gloves?" Right? And we just worked through that. We slowed down. I validated. I paced. I acknowledged, right? I empathized. And we did it. He did it. He got the gloves on. And he was ready to move on. And he was regulated and okay the rest of the session. This is a kiddo who is autistic, has a lot of self-esteem challenges, has a lot of shame, has a lot of decreased sense of self that we have worked through over the years. And so when I think about this, right, what we see a kiddo coming in, "Stupid, this is stupid, my hands are stupid." And while I could right away say, "You know what, buddy, that's not how we talk. That's, okay," but that wasn't supporting what was underneath. What was actually happening? What was the communication that he didn't have to explain what he was feeling and experiencing in a different way? And we were able to provide that to him. So when we think about that, again, we go back and we remember the front brain and the back brain. He was dysregulated in that moment. He was in a state of distress, in a state of frustration, and not feeling confident and competent, and wasn't able at first to be logical and to really think, "Okay, how can I do this? I know that I can do this, but how do I do it?" He wasn't quite there yet, so we had to get him there. So kind of moving further along, how do we help? How do, here at Easterseals, do we see our kiddos and support them? So one of the biggest things is individual differences of our kiddos. And so we're always looking at their communication and their language production and development. Obviously, children with individual differences and disabilities have language processing disorders. They have comprehension challenges. So we're always thinking about what is their level of comprehension? How do they express their language? Is it through nonverbal communication? Is it through verbal or limited verbal? Is it through a communication device? We always want to be thinking about how do they communicate and how do we support their communication. Sensory processing differences. How does their body process sensory input? And how do we make sure that in a moment of distress, that we are acknowledging that and we're setting up the environment that supports each of their own sensory systems? Cognitive processing abilities, their motor abilities, emotional and behavioral patterns that we see, environmental stressors that they may be experiencing now or have, family stressors that they're aware of or have been experiencing, and challenging experiences in general that they have had, like when we think back to any of medical trauma or just anything related to their individual differences. The other piece we always want to be very mindful of is trauma-informed practice. So if anyone is familiar with Dr. Bruce Perry, Dr. Bruce Perry and Oprah Winfrey together wrote a book, and it's on trauma, and they titled it "What Happened to You?" And this was a shift. This was a paradigm shift from viewing what's wrong with you, right? What's wrong with that person, to what happened? What happened to you? What happened in your journey? How do we acknowledge what you went through and looking at it through that frame? Again, considering those individual differences and experiences is trauma informed. Creating a safe and supportive environment. Developing trust and rapport, key for us to be able to work with these kiddos and their families. We have to have a sense of trust with them, for them to trust what we can do to help them, but trust that they have too, that they can do this work. Fostering self-understanding, acceptance, and empowerment. We want to make sure that we're considering all different developmental, so neurological, biological, psychological, social, emotional, taking into consideration culture, and making sure that we're collaborating with the families, collaborating with our clients themselves. And again, leading back into that place to ensure that they're empowered. We want to take into consideration the environment and the approach. So these are a few of our treatment spaces. We're always thinking developmentally. We want to make sure that when we're working with a kiddo, that we're working on developmentally appropriate stages in their bodies and in their lives. We want to think again about this space. And so we have at the bottom, you'll see one of our sensory rooms. And so you can't see it, but on the ceiling, there are swing hookups. And so we know that the kiddos that we see need movement. Again, when we think about their sensory systems, they need to move. They need to be able to access things. And so we make sure that obviously all of our OTs and physical therapists and things like that have rooms like this, but we wanted to make sure that we were honoring a child's sensory system as well, to provide that during our treatment. And then up to the right, we have one of our playrooms. That is another foundational approach that we use, is play therapy. We know that is how kids learn. Play is learning. And it provides a safe space for kiddos to play out things that maybe cause stress to them. That is not direct. We're not sitting and talking about, right, their medical trauma or their diagnoses or things like that. Some kids do. We do. I have a 18-year-old that does like to sit and talk and just kind of process through everything. But majority of my kiddos are doing that through play. And the play looks different. Sometimes it is playing completely pretend play, symbolic play. Other times it is talking while shooting a basketball or playing soccer. And working on things through that type of work, helping them to establish that sense of self and that confidence, working on sportsmanship, working on winning and losing, all sorts of different things. And then in the picture to the left, we have an art room. And so just different access to different modalities. We have kiddos that like to create things with clay, like to paint, like to draw. So we just want to make sure that we are, again, thinking of their own motivations, what draws them in, how they express themselves, and being able to provide different avenues to that. The other approaches are interdisciplinary intervention, as we had mentioned. So we have occupational therapy that we work with, speech therapists, physical therapists, nutrition, audiologists. And then we don't have vision on site, but we have a vision clinic. We have a developmental optometrist that comes in and provides vision clinics to our kiddos, and a lot of our kiddos do have vision challenges, and so we're always making sure that we are understanding their visual system as well, and OTs work on that too. So we do a lot of co-treats. Social work and OT will co-treat together, again intersecting that mind and body, and so we're always working together as a team. And then obviously one of the biggest things is the relationship. And so that is like the foundation, right? We want to go back to, again, that trust and mutual respect with one another. Acknowledging and validating. I see you, I hear you, I believe you, right? I believe these struggles, and I believe that we can work together. Empathy and understanding. Partnering together. Providing a safe and supportive environment. Of course, a non-judgment zone. Always active listening. Ensuring that there's connection, and then providing that encouragement. And so that's a big basis of what we make sure that we do is that core relationship. And so the messages that children often need to hear that we want to ensure is that they're not alone. And so they need to know I'm not alone, that we're going to keep showing up for them, even when they push us away, that we're not going anywhere. They need to hear, you see me, you hear me, you're trying to understand me, that you aren't scared of my big feelings. I don't have to be in charge of my parents' or caregivers' feelings. And I'm not a bad kid. I'm not a bad kid. I'm just having a hard time and I need the help. Okay. That is what I have had. I feel like it went quicker than I had thought, but we have lots of time then for open discussion and any questions and any reflections, or any just takeaways, anything that kind of sat with you. I'm actually glad we have some time to kind of collaborate with one another. So let me stop sharing my screen and see what I can expand upon would be helpful for everybody.
Any comments or questions for Brittany? Feel free to just speak up since we're got a small group today. It was a great training, by the way, Brittany. I didn't know all the services that you provide, and so it's wonderful.
Thank you. Yeah. We do. It's amazing all the services that we're able to provide, and everyone that is able, just the expertise that we have here is it's amazing. Yes. Yeah.
So I would say I thought it was really impressive of like the true integration of mental health and IDD, because I know that it seems like that's hard for a lot of places to do that, where even if it is a DD agency and they provide mental health services, it still seems a little bit fragmented, where like they're not fully looking at the trauma that can come from having a developmental disorder as well. So I thought that was really awesome of that true integration, and nothing like against other places. It's, just even the thought of even mental health services, providing services to people with developmental disabilities instead of thinking that they're inclusive without providing those services. So anyways, I thought that was really cool, just like that true integration. And then just like the dysregulated system. I know like it has taken decades for me to like get my system regulated. And so yeah, I'm like, man, if I would have had more of this stuff when I was a kid, my system would have maybe been a little calmer, but
Yeah. Yeah, thanks for sharing that. And it, you know, it's I hear quite often where, you know, parents will come in and be like, I needed this as a kid, right? Like, this is so great that we have this understanding and we're expanding our knowledge and understanding kids, you know, and their bodies and their differences and everything like that. And exactly, I have a parent that literally just said, you know, gosh, if only I had someone who understood me this way, you know, when I was a kid. And she's like, I'm learning more about my body now, but that would have a difference that would have made if that would have been available to me as a kid. Yeah. Yeah. We're actually also seeing a lot of parents even just get diagnosed themselves, you know, with just different developmental things, you know, autism, you know, ADHD, lots of, you know, just lots of different things. And just kind of like through their kids, like, wow, I feel like something is, you know, in me that I'm more aware now too. Yeah. Yeah.
Hi, this is Colleen here. I
Okay.
just wanted to comment. First of all, I really appreciated your presentation, Brittany. Thank you for that.
Yeah, of course.
My daughter was diagnosed with a mental health condition over 15 years ago, but she had significant trauma in her life.
Mhm.
Um, and I feel like that trauma was never addressed. They were so busy focusing on medicating her and addressing her quote unquote mental health condition that they
Yeah.
never addressed the trauma. And now in her 30s, she still continues to have some of that dysregulation because of unaddressed trauma that happened to her. And it was just the therapists, it wasn't because we didn't take her to therapy, it was just they didn't seem to be skilled in being able to work with a trauma client.
Sure.
Right. So that I really could appreciate that. And especially with one who was at the time a teenager and they don't always want to talk. And
Yeah.
she was one of them. When they would say, how are you doing? Her answer would be, I'm fine, type of thing. So, you know, being able to get to the root of it when she was younger at that time, I think would have eliminated quite a few of the issues that she has been struggling with.
Thank you for sharing that with us. You know, it is, and it's hard because again, you know, we look at, right, that's where I go back to like the behaviors, like what we see, right? What we see. And so there's so much treatment of like, let's treat what we're seeing, but what is that underneath and how do we support that the iceberg, right? That the bottom, not the tip, but that bottom of the iceberg. And Colleen, I want you to know too, you know, your daughter's not alone, you know, in that. And there, I think there's so many individuals that walk around with unresolved trauma and things keep coming up for them. And there's always a time and a place and space for continuing to process through those things, even in adulthood. There's lots, I mean, even those implicit, you know, as I was talking about the implicit memories, you know, for us and the kiddos that we work with, we see that there has been medical trauma and developmental delays and how trauma impacts that. But there's so many individuals that don't really necessarily recover or uncover that trauma until adulthood, right? And so that definitely happens. And so I just want you to know, like, there's still always space, you know, space for her to kind of learn more about her body and how that trauma impacted her, and how to, we call it rewiring, right? We rewire the brain, we rewire our nervous system to adapt to new neurological pathways so that we can regain that regulation and not have that exact same stress response. But that takes time. It definitely takes
Yeah.
time.
Thank you
Yeah,
so much, Brittany.
absolutely. Yes.
Any other comments or questions for Brittany?
Sorry, I'm like, if not, so I could quickly add, Colleen, when I was providing direct services in for substance use, which was a lot of youth unresolved trauma. And so I have been out of that for about 7 or 8 years. And even during my tenure of doing that, there was still very much a divide of like mental health professionals would not address people with severe trauma. Or
Yeah.
so there's kind of like this list, like people that had severe trauma, or if you were using substances, it was, the which has to come first? Do you have to be sober? And so there was just a lot of developmental disabilities. There was a lot of divide, and I had a lot of clients, whether it was childhood or even adulthood, with very severe trauma. Um, and they had said like repeatedly, like people, like they just couldn't ever get help, even when they were asking for help because professionals just wouldn't do it. So I think we're seeing, like
That's,
what
yeah.
Brittany said, like a huge paradigm shift in that book from Dr. Perry and Oprah, which is mainly Dr. Perry. I mean, Oprah just was kind of like, giving her like, woo, woo. But it's like really easy to like understand, which is beautiful. And so it's really awesome. We're seeing more of a true inclusive paradigm shift of getting people what they need instead of turning people away.
And just medicating them to, subdue the symptoms, which doesn't help at all. So yeah, thank you for sharing that, Amy.
Great. Well, this has been informative. Appreciate it, Brittany. Can we get a copy just to share with the members and those that weren't able to join us of your presentation? I'm sure that would be much appreciated from everybody.
Yes, absolutely. Yep, I'll email it to you and then you can kind of disperse that and then let me know. I kind of tailored, I know we had talked, right, like tailored the presentation to just information about Easterseals and then just kind of like surface level of, just kind of some of the intersection, but please let us know if it would ever be helpful to dive further into kind of any of the topics that we went over. And I'm happy to kind of, dig deeper and go through more things, just more thoroughly too. I'm happy to do that.
Appreciate that. Yeah, I'll share that, with our committees and see, if they'd be interested in that. Definitely.
One other thing that I'll mention, I just wanted to share this. I didn't bring it up, but as we were talking so much about like just medical trauma and things like that, one of the services that one of our social workers has, so she has more of a medical background. She has a passion for a medical background, and so she developed a medical procedure support program. And basically what that is for any of our kiddos or outside of Easterseals, this is open to the community, but any child that is approaching any type of medical appointment and they're having just distress around that, or the parents are worried and concerned about it, we have like a 4-week program where our therapist meets with the parent for a parent meeting to discuss what the procedure is. And then the social worker meets with the child 2 times before the procedure to just kind of play through, use art, use play, use different modalities to really kind of go over what's this going to look like and how can we help prepare you for this. And then the procedure happens, and then the social worker meets with the kiddo after the procedure just to kind of process through what happened, what it was like, and everything like that. And she's done different ones from like a dental procedure to thank you, Amy, a dental procedure, blood draws, anesthesia. We've had to do anesthesia. We've had to do just different things, right? It kind of just anything that comes about. And then also too, again, I think the biggest piece is helping parents to know, what do I say? How do I help my child through this too? And what questions do I ask the providers to know how to help prepare myself and my kiddo and everything like that. So that's just something that I always like to share with everybody because, yeah. it's
It's
a great
amazing.
resource. Yeah, yeah.
Very useful for all parents.
Yes, yes, definitely. Yes.
Yes, thanks for sharing about that program because I know that can be awful. That my son had to go get tubes in his ears, and they're like,
Yes.
"Oh, we do these all the time. Like we can do X amount of these every day." And I'm like, "Well, we don't do this every." And it was the person before him didn't show up, so then they bumped his appointment up where he was the first one to go. So the social worker had to come around to do her visit with us. And then all he knew is he's going to get a mask on his face and then he was going to go to sleep, which for him, that was like, what do you mean? We couldn't get him in the sterile pajamas. It eventually turned into a doctor come and grabbed him, mask over his face to knock him out. And then it
Oh,
was awful when he woke up. It was hours of screaming because they're like, usually however they get knocked out is how they wake up. So it was
yeah.
like, and then he was like, never wanted to go back to the doctor. And I'm like, fabulous.
That's
Now
right.
you've just scarred him for years of even just, but
Yes.
yeah. So I love that you have for this.
Yeah, I could have
Yeah.
used it too. I have similar, nightmarish experiences. Yeah, tonsils, adenoids, it's like,
Oh,
oh my gosh, yeah. And they're just so brutal. Even just having a dental procedure, a cavity removed. I mean, I've had, yeah. So yes, this
yes, yes.
would be wonderful to know. And I guess my question that came to mind is, are
Yeah.
there similar entities? Like, is there a list of similar entities? So as a reference for our other members, that are out of that area,
Mhm.
or our other boards, because you specifically work with Hanover Township, right? I mean, I don't know other mental health boards that you work with, but just curious if you have a listing of other similar organizations across the state.
Across the state that we particularly work with, or that would just kind of have the similar programming.
Yeah, similar kind of programming type thing.
Yeah.
This is informational.
Yes, yeah, let me see what I have, like what our care coordinator has and what our development have, just to kind of like support. In terms of I mean, I know that there are other agencies that provide like the interdisciplinary things like that. There are, I know, like with like medical diagnostic, I know there's not a lot of medical diagnostic programs out there. Like our medical support, like there are some things that are unique to us, but yes, definitely let me send some resources and referrals to you, just in other navigating. And we are Hanover Township, and I'll list out two for you, just kind of where, because when we're in Villa Park, we're in Naperville and Elgin around Hanover, so we're obviously in those suburb areas in those counties, but farther out we'll try to definitely get you some
Great.
resources for sure. Yes.
Been wonderful. Thank you so much, Brittany, for all this information, and all of you for joining us and sharing your own personal stories and whatnot.
Yes.
Thank you. It's been great.
Yeah, thank you so much, everybody. Thanks for allowing me the time to share.
Thank
Thanks for
you.
sharing with me too. Absolutely. I hope that it was helpful.
Very. Thank you.
Yes, you're welcome. Okay, take care, everybody.
Bye.
Bye.